Okay, good afternoon. Good afternoon. Thank you all for joining us today. We have a different time today, 2:30. Tomorrow we'll be back to normal, 1 o'clock every day thereafter. As you can see from the data displayed on the screen, we do see more cases today than yesterday. 365 cases tested, 2,400 people. Having said that, we're kind of, at the moment anyway, hovering at a bit of a plateau. I don't know that we can say it's a trend. I don't know that we can say precisely where we are in the peak, but because again, we're looking for a trend over a number of days. But I do know it's good news. This is a good day, and this is a good news day, because we are clearly, if you look at the hospitalizations and the ICU hospitalizations, everything's very stable. Although we haven't yet started to decline, and we may still be not quite at our peak, this is good news. This is good news that we are seeing we're in a stable place. All of the decisions we've made and the hard work that you've all done to wear masks, wash your hands, stay at home, definitely stay at home when you're sick. These are all the important and necessary things, and you're starting to see real impact. So I hope that you will take some heart in the data that we're showing and feel that we can start to see some light at the end of the tunnel. I will say none of the progress that we have made to combat the virus would have been possible without so many public-private partnerships. Obviously, we in the government are working incredibly hard, as are healthcare workers and first responders, but many in the private sector as well have really stepped up to help us get through this. Yesterday, I highlighted the great success and work at the field hospitals, at the convention center, and the former Citizen site in Cranston. Again, huge thank you to all the teams that made that possible. A special thank you to the building trades. I have visited these sites, and it was extraordinary, the level of work and effort and collaboration that the building trades put into this. They accomplished a couple of months of work in a few weeks. So thank you to the leadership and to the membership for your collaboration and partnership. You should be proud, and I'm proud of you and grateful for all you did. I want to say thank you today to President Shanley at Providence College. Give a special thank you note to Providence College. The college is transforming their dining hall into a central kitchen that will provide food for the field hospital in Cranston. So I want to thank you. Sodexo staff will be preparing, packaging, and delivering food. And, some people have said to me, kind of, what's your strategy? My strategy is to work with anybody who wants to pitch in and to fit folks in the best places that we can. Yesterday we thanked Brown. Today we thank Providence College. Again, thank you to CVS. Thank you to the building trades. I mean, so many people are saying, how can I help? Where can I be? How can I fit into this? And it's because of all of that and all those partnerships that we're in a decent place. We're not. Every time I say that, I stop myself, because if you're at home and you're out of work, or your kids are struggling to learn with distance learning, it doesn't feel like a decent place. But relative to where we could have been, and relative to where some cities and states are, we're in a more stable place, and that's very much because of these great partnerships that I try to highlight on a daily basis. Earlier this week, I laid out 6 key indicators that I am using as our guiding principles as we look to reopen the economy. And as I've said many times, this will not be a flip of the switch. And I worry about that, to be very honest, because we've all been cooped up for a while, and I really worry that once we start the process of reopening, it's human nature to want to jump the gun. So we're all going to have to, as I've said, we're going to have to be brave. We're all anxious to go to work, but when the time comes, we'll have to be brave and start to go to work. But we also have to be careful because we're going to be living with new conditions for a long time. And if we don't follow the rules, we'll be back to where we were a few weeks ago. So we can't do that. And so I'm going to talk about this every day so that we all start to really internalize what our lives are going to be like for the next 6, 9, 12 months until we have a cure and until we have a vaccine. Today I wanted to spend a couple of minutes, a minute, talking directly to our older Rhode Islanders on this theme of getting ourselves ready for what's to come and what life might look like in the months to come. We have been working as hard as we can to make it so that if you are staying at home or if you get sick and have to be isolated, that we can provide services to you. The nextdoor.com is still a service that I would commend to you, nextdoor.com. You can sign up and find if there's someone in your neighborhood who'd be willing to do an errand for you. That's especially important if you are 60 and above to be thinking about that. We have the RI Delivers option. You know, we're trying to make it so that if you have to stay home, when you stay home, you can have services delivered to you. This is going to be particularly important if you fall into the category of folks who are 60 years old and above. When we start to reopen the economy, we are going to have to pay special attention to people who are 60 and older. Sadly, we know that those are the folks that get hurt the most by this virus. People who are 60 and above, and people who have underlying health conditions. So as we start to relax some of these stay-at-home orders, the social distancing requirements, I just want people who are in that older age group to start to come to terms now with the fact that your reentry is going to be a bit different, a bit slower, and you will continue to have a different set of regulations designed to keep you safe and healthy and alive and well, and all of your loved ones. That's why I mention now to you, if you haven't checked out nextdoor.com, you should do it. If you haven't figured out a support structure for how you could stay home if you needed to, now's the time to start thinking about that, because we're going to continue to keep some restrictions on folks even as we go into our what we call a new normal. I will say I struggle a bit with what's the right word to call people who are 60 and above. I know if I call them senior citizens, my brother and my sister would not like that, so I'm not going to go down that path. But I just want to say the reality is the older you get, the worse this disease is. And we want to take care of you. We want to take care of everybody. And so social distancing, figuring out ways to continue to work from home, figuring out ways to keep yourself safe, important for everyone, especially important for folks who are 60 and above, doubly so for people who are 70 and above. But I'm hammering on the 60 and above because, frankly, there are many, many, many people between 60 and 70 who work. And by the way, that's great. You have active, full lives. Many of you are still working part-time or full-time. And, that's a great thing. But I just need you to start preparing yourself that we want you to keep working from home wherever possible. If you're an employer, yesterday I was asked the question, what can employers be doing right now in thinking about how to prepare for a new normal? Start thinking about how you're going to handle your older employees. We have lots of employees in their mid-60s, and we have to take care of them. So what are the extra precautions does that mean? I know some larger companies are thinking of providing their more senior employees extra vacation time. additional sick time, additional accommodations so they can work from home, additional precautions taken around social distancing, thermometer temperature taking. So I don't know precisely what the regulations are going to be for folks in different age brackets. But I do know that the disease affects people differently with different underlying health conditions and in different age groups. And I just want everyone to start thinking along these lines and getting prepared so that in a week or so, when we start to give more details, you will have had some time to get yourself ready to think about it. A few other announcements about testing. As I've said, a key component to keeping everyone safe throughout the crisis and the disease is to make sure that everybody can get tested. Now, maybe you've seen some of the national press, but Rhode Island is doing really better than any state when it comes time to testing, which is good news. It means we're that much closer to getting back to work. Having said that, if you don't have a car, it's hard to drive to Twin River and get yourself tested at the CVS testing station. If you, struggle to get out, or if you live in certain communities, it's just more difficult. If you're living below the poverty line, if you're homeless, if you're housing insecure, all the hurdles that make it more difficult. And I am completely committed to making sure that every Rhode Islander, of every race, zip code, and income level, has equal access to testing. So we're working on it. We're working on more mobile testing. We're working on walk-through centers. We're working on testing right in the community. We're not where we need to be, but we are literally making progress every single day, and we won't stop until we have testing centers throughout the state. So a few days ago, I announced our first walk-up testing site at Bailey Elementary School on the south side of Providence. And so far, it's been in partnership with the Providence Community Health Center. The site is already testing about 50 people a day, and we're optimistic that we'll double that number by next week. So if you live in that community, call first. You need an appointment, but then you can go ahead and walk over there or ride your bike over there. And it's in the community, and it's testing, and it's available. It's not just Providence, though. There are other urban areas where folks need testing in their community. So I'm announcing today that we're opening a walk-up site at the Memorial Hospital in Pawtucket. And this site will work in conjunction with the drive-through respiratory clinic that is already at the old Pawtucket Memorial and that I mentioned a week or so ago. So the walk-through site will allow us to expand our testing population in that facility for another 50 to 100 people a day in that community. Lots of people live within walking distance to Pawtucket Memorial, and so we wanted to provide something rooted in the community. And the mayor of Pawtucket has, been working closely with us and urging us to make this a reality for his community, and I want to thank you for that. Now, as a reminder, you still need an appointment. So if you have a fever or if you have other of the COVID symptoms and you live in Pawtucket and you want to go through this site at Pawtucket Memorial, you need to call 401-CARE-NOW. And this will all be up online, 401-CARE-NOW. You can get your appointment to have a test at the walk-through clinic at Pawtucket Memorial. I have to thank the folks at Care New England. The team there has been terrific. We're operating this site in partnership with Care New England. They've helped us set up the site, and they've helped us to make sure that they have adequate phone lines so that if you do call that number, they have over a dozen phone lines staffed in multiple languages so that, anyone in the community, go ahead and call that number, multiple languages, multiple phone lines, we'll get you in as quickly as we can. On a happier note, or on a brighter note, a reminder that today is Earth Day, actually the 50th anniversary of Earth Day, and obviously here in the Ocean State, that's a big deal. We've worked so hard for so long to improve the quality of our air and our water in Narragansett Bay and the land. We have some of the most beautiful parks and beaches in the country, and it's just time to recognize that. It's obviously incredibly difficult right now that we can't be using our parks and beaches to the extent that we would like to. It's frustrating for me and my family and all of you. So in honor of Earth Day, today I'm announcing an effort to reopen our parks and beaches as being part of the first phase of lifting restrictions. And I've asked Janet Coit, who runs DEM, to come up with a plan around a phased approach for reopening our state parks and beaches, and I hope to be able to announce that plan to you in about a week. So mid to late next week, we'll announce that plan to you. It is my hope that we'll begin to be able to enjoy our parks and beaches in some form or fashion, again, in the month of May. Now, I want to be clear, I'm not reopening parks and beaches now. We're not reopening parks and beaches this weekend. And when we do it, we're not going to just reopen them. We'll be reopening them, like everything else, in a staged fashion, slowly, with new restrictions, incrementally, leading up to an eventual complete reopening, also with new restrictions. But what I am announcing today is that I've tasked Janet Coit to work with the Department of Health and stakeholders in the community to come up with a plan, which I can announce next week, for a staged reopening of our parks and beaches. And this gives me hope. It's exciting to think about it. It's exciting to think that sometime soon we can take our kids again for a walk, or drive to the beach and go for a walk, or drive to a park. Not there yet, but hope is on the horizon. I will say also, in honor of Earth Day, I do want to ask everybody to be careful about littering. It's a very unfortunate reality that since the COVID crisis has hit us, littering has increased pretty significantly, and it's increased quite significantly in littering of PPE, masks, gowns, gloves. It's not safe to dispose of used PPE by throwing it on the ground. So that's point number one for public health. It's also terrible for our environment. So let's do the right thing. It's Earth Day. Here, we're in Rhode Island. We're in the Ocean State. We care about our planet. We are committed to fighting climate change all the time, whether in COVID crisis or not. So let's do it. Let's pick up the trash, not litter in the first place, dispose of it properly, and let's keep our state beautiful as we get through this crisis. Finally, I want to share some new news that our tech team has been working on around symptom tracking. So as of today, we've launched a new web tool that will help Rhode Islanders make decisions about seeking appropriate medical care and testing. The new web tool is called the Rhode Island COVID-19 Self-Checker. We are partnering with a company called Diagnostic Robotics to roll out this new application. The Self-Checker is available in English, Spanish, and Portuguese, and it is at covidselfcheck.ri.gov, or you can just go to the Rhode Island Department of Health website. On the new website, the covidselfcheck.ri.gov, you'll be asked a series of questions related to your symptoms, your potential exposures, and other risk factors. The tool will help you make decisions about when to seek care, if you should go get a test, if you should call your doctor, and also offer tips related to prevention, testing, quarantine, and isolation. The guidance that's being offered through the Self-Checker site is based on CDC guidelines and has been customized to connect Rhode Islanders with local information and resources. So I want to thank everybody who worked on it, everyone on the tech team, National Guard, everyone at the Department of Health, our partners at Diagnostic Robotics. I think this will be a great tool for everybody, and we can continue to use it in the months to come. It provides some comfort that there's a place you can go, check in. It provides some guidance. Now, I want to be crystal clear. This tool is not a substitute for visiting your doctor, for calling your doctor, or for seeking professional medical help. It's a guide for helping you figure out if and when you should do that. And just to help you, I think one of the things right now that people need is kind of what can you do to take care of yourself? That's something I know gives me comfort, and people are asking. You want to take care of yourself. You want to take care of your family. You want to take care of your employees. You want to take care of your loved ones. So it's just another tool which will provide you with some information, bring down your anxiety, help you get smart, keep yourself healthy. Education is key to health, but in no way is it a substitute for calling your doctor, visiting your doctor, going to the emergency room if you feel that is necessary. So there's a lot of information. I'll be back to answer questions, and I'll now turn it over to Dr. Nicole.
Thank you, Governor. Good afternoon, everyone. Once again, I want to thank you all for continuing to tune in and doing such a great job following our public health guidance, as well as for being such good ambassadors for us by sharing information with the people in your life. Let's help continue to make sure that these messages get out, that we encourage each other, and continue to hold on and following the guidance that's there. I also want to publicly thank all of the staff who worked to make the SelfChecker online tool that the governor spoke about accessible to Rhode Islanders. Across state government, folks have contributed to making this work, and of course also at the Rhode Island Department of Health. It's a tremendous tool that is available that we want to continue to offer to everyone. To get into the numbers, we have 365 new cases with a total of 5,841 cases. As the governor mentioned, we unfortunately have 10 new COVID-19 associated fatalities in Rhode Island. The age distribution for these 10 people is more or less consistent with the age distribution that we have been seeing for other COVID-19 fatalities. There were 2 people in their 60s, 1 person in their 70s, 4 people in their 80s, 2 people in their 90s, and 1 person who was older than 100 years old. We want to extend our condolences to those families involved. 6 of these people were females, 4 of them were males. And of these 10, 8 were nursing home residents. Some additional data that is accessible on our data dashboard regarding the 365 new cases in Rhode Island is that there are 270 COVID-19 patients in Rhode Island who are currently hospitalized. 71 of these 270 people are in intensive care units, or ICUs, at hospitals in Rhode Island. In addition to sharing these data points, I want to pass along a few quick reminders that help guide us in seeing how we can continue to take care of ourselves during this COVID-19 unique and unprecedented time. Last weekend, Dr. McDonald talked about the need for people to continue to seek routine medical care, such as pregnancy care, checkups for babies and young children to continue to get their vaccinations. It's also important for people to remember that if you have dental concerns, your oral health providers are still there for you. Many dentists are using telehealth and can help you over the phone. And of course, if you have a dental emergency, you can call so that you can see a dentist in person. It's also important to remember things you can do at home to keep your mouth healthy, like brushing, flossing, and drinking water instead of sugary beverages. While I'm talking about oral health, I want to thank the dental community, the dentists, the dental hygienists, the dental assistants, and office staff for your partnership through this. We can be proud of our Rhode Island dental community, which has always put safety first through an emphasis on strict infection control. While many of us are just starting wearing masks, just getting started with that, this has been what we've seen our dentists do for many, many years. So I'll finish with noting that it's wonderful that it's sunny outside, and I want to provide some guidance to people who are going to be outside today, acknowledging the 50th anniversary of Earth Day, or who will be outside in the coming weeks and months. Rhode Island does have the 5th highest rate of Lyme disease in the country. On top of that, we had a very mild winter. So there are many more ticks than usual that have likely survived until spring. And this means that 2020 could be a notable year for tick bites and Lyme disease and other diseases. But have no fear about that. It's something that we are used to. We don't want that to discourage us from being able to get outside safely and appropriately. If you are feeling cooped up, if you're thinking about getting outdoors and going for a walk in a place in Rhode Island where it is permitted, it's critical to remember to take measures to protect yourself and your loved ones. The 3 keys are repel, check, and remove to help prevent any of these tick-related illnesses that I'm referring to. Repel means keep ticks off of you, your children, and pets. Avoid wooded and bushy areas with high grass and leaves. And if you're going to be in a wooded area, social distancing appropriately. Walk in the center of the trail to avoid contact with overgrown grass, brush, and leaves. Check means check yourself, your children, and your pets for ticks. Taking a shower as soon as you come inside if you've been in grassy or wooded areas. A full body check of yourself and kids is important in being able to do that. And then remove. Remove ticks from your body as well as from children. You can use a set of tweezers to remove the tick. Grasp the tick as close to the skin as possible and pull straight up. And if you don't have tweezers, you can use fingers with a tissue or rubber gloves. As we continue to respond to this COVID-19 pandemic and look forward with the governor's guidance and a tremendous team on reopening the economy and figuring out ways to achieve our new normal, we want to make sure that you are all equipped on how to do that safely, but to be able to enjoy the beauty of Rhode Island, particularly on days like today, our Earth Day. It's important for us to be mindful of all of the things we need to do and to continue to do to keep ourselves healthy and safe, as well as our family and loved ones. So with that, we're going to pass it on to start questions.
Good afternoon.
Hello.
We'll begin with a question from Scott Isaacs, the news director at NBC 10. With the casinos and sportsbook closed and tax day pushback, just how bad a hit is it to state revenues? What options are you considering if social distancing keeps the casinos from reaching normal business levels for a significant period of time?
Yeah, it's a great question. So a few answers. We don't really know. The answer is bad. Like, to be very clear, our state, every state, I'm talking to governors every day, our revenues have absolutely fallen off a cliff. It isn't just the casino, although that's our 3rd biggest source of revenue. It's, as you say, pushing back taxes. Many people are out of work. Generally, the economy is softer. That's much softer. So we don't yet have a great estimate on how bad it will be. Obviously, we will know a lot more as the weeks go by when we can take an assessment of the revenue. But to be clear, I'm not going to sugarcoat it. It is going to be very difficult. I have been in touch with Governor Sisolak in Nevada, where there's Las Vegas, obviously, trying to get good ideas around creative ideas for reopening casinos at the appropriate time, in the appropriate way. We've asked the folks at Twin River to, start preparing their plans, but we can't do anything that's unsafe. I will say this, we have received, thankfully, and again, big thank you to our federal delegation, the stimulus from the federal government. We don't yet know precisely the rules around how that can be spent. We are hopeful that the Treasury Secretary is going to be putting out guidance this week, next week. When we get that guidance, we'll know much more around how much of that can be used to help with our state budget. And I also know that our federal delegation in Congress is working on another stimulus package for states and localities. So, long-winded way of saying, in about a month, I think we'll know quite a bit more about our situation fiscally, but it's important for people to know it's going to be a difficult task, to be sure, in order to balance our budget.
Steve Alquist of Uprise RI notes many of the current difficulties facing essential frontline workers, including healthcare workers and store clerks, are the result of failed state policies that have dismissed the lives and contributions of these workers in the past. And he asks, what specifically needs to change going forward?
I don't think I would agree with your characterization, but I will say this. I've been quite clear that we have to do everything we can to help our frontline workers. We are working on how to get them more personal protective equipment, how to enhance their wages, making sure that there are appropriate benefits in the meantime, fighting hard to get additional SNAP benefits, which I was able to announce a couple of days ago. So, there is much more to do. We have to continue to lift wages. And frankly, we have to continue to increase education levels. One of the most heartbreaking things about this crisis is that if you look at who is hardest hit in the economy, it's folks who are lowest skilled, lowest paid. And so we're going to get them through it now, through protecting them and increasing their wages and giving appropriate sick leave and sick time and paid leave. But the real thing we need to do is to upskill folks so they can make a decent living with decent benefits and a decent job. And that's something that we have to keep. This crisis has laid that bare for us, and we have to recommit ourselves to that mission.
Brian Crandall from Channel 10 News asks, what do you say to older Rhode Islanders who believe they're in good shape and don't want to be bound by new restrictions from when businesses, organizations, churches begin to reopen?
So it's a great question, which is why I started to bring it up today, and I referenced my brother and sister who were both, full-time working and over 60. We're going to roll out new rules. There are going to be new rules designed to keep everybody safe and healthy. Employers are probably going to have their own rules for how they deal with their workforces, and we're just going to do what we've done from the beginning, put out the facts and the data. There's not going to be anything unnecessarily severe. There isn't going to be anything that'll, I think will make lives difficult for people. But the brutal reality is that when we start to reopen the economy, you're going to see a lot more cases. It's going to be hard to prevent that. And we also know the brutal reality is people who are older, the older you are, the worse it is. If you have an underlying health condition, the worse it is. So it's just the right thing to do to put out additional guidance based upon the level of health risk that different categories face.
Matt Allen from WPRO Radio asks, yesterday you gave an outline of the type of things businesses should think about when planning for the reopening. Today I heard from some restaurant owners and salon owners who want to know when they will have hard guidelines to plan for. Do you have a timeline for when you will release these guidelines?
We will have much more information next week, and then even more detailed information the week after that. So we're going to, I gave a bit this week, Monday or Tuesday, I plan to focus the entire session on exactly those questions, and then as we get more information and more detail, we will provide that. We're also we're working on a website, so this will be all out and able to be clearly followed. What we're spending a lot of time on doing now is consulting with people who are in business. So consulting with the manufacturers and Manufacturers Association, consulting with Hospitality Association, consulting with hairdressers, consulting with public health experts to try to get the best information that we can. So starting next week, we're going to start to roll out a lot more information so you can get to work and start your planning.
Tara Granahan, also of WPRO Radio, says, Dr. Pablo Rodriguez has said everyone is freaking out in the Latino communities over the COVID-19 spread. Will you call on Mayor Elorza and all Spanish radio stations to get more involved?
Absolutely, and you know, Pablo, you're in good touch with my office and me, so if you have specific ideas, I'm always welcome to do that. I would say this, as I've said from the beginning, facts over frenzy. I understand why you might be freaking out, but through freaking out, panicking is never helpful. What we need to do is stay as calm as we can, work as hard as we can. We're going to put more testing sites in urban neighborhoods and Latino communities. I really need your help in the community to enforce and reinforce the importance of social distancing, stay at home, you know, being careful for communal living, and we're just gonna, you know, arm ourselves with facts, and we're gonna up our response. And I will absolutely call Mayor Elorza, and I will absolutely call on Latino Radio to do more, but I would just say, let's do our best as leaders to try to keep some calmness in the community, because when, I know from experience, when people freak out, to use your word, it's just not that helpful. So let's keep folks calm, keep the complaints coming to me so we can keep acting, and yes, I'll reach out to those two groups.
Bill Bartholomew notes, Governor, we appreciate your response to requests to expand testing in the urban core. What are your expectations or goals for a daily number of tests per day in the urban core, rooted in the community, and by when?
Good question. I don't have a aggregate number off the top of my head, but I'll tell you how I think about it. We know we need more in Providence. We know we need to get up to Woonsocket. We know we need more in Pawtucket. We know, we know the communities right now that we're just not doing a good enough job at. And then each one of these, as I said earlier, probably the walkthrough type operations will be 100 people a day or so. So I've been thinking about it in partnership with mayors, municipal leaders, community groups, Department of Public Health, like, where are we missing? And so, by the way, to the extent that you have information about where you think we're missing, you let us know. They're all likely to be small, right? By necessity, there's going to be a lot of different spots, all pretty low volume, and that's how we want to try to address it.
Richard Asanoff of Convergence RI asks, have you begun discussions about how to reimagine the future economy in Rhode Island, as well as the future healthcare system in the post-pandemic world? Who will you invite to be involved in such conversations? Mm-hmm.
Excellent question. Right now, let me remind folks, we're still in crisis mode. So I'm, like everyone, I'm really anxious to get out of this mode. But, today we're still trying to figure out How do we get adequate testing up and running to start to reopen the economy? How do we really, truly, adequately supply personal protective equipment to all of our frontline workers and all of employees in our critical infrastructure industries and all of our hospitals and nursing homes? We still aren't where we need to be on mobile testing for nursing homes and group homes and developmental disability congregate living. We're still not where we need to be on a number of metrics. We are still struggling on a daily basis to make sure we have the supplies we need in order to keep up all this testing. So Richard, you ask a terrific question. We're not quite there yet. We are still trying to put the fire out. Soon we will get to those future kinds of discussions, and then obviously we'll bring in a broad group of stakeholders to think about it. I will say this. If you look at our healthcare system, and I mean America, not just Rhode Island, we are very, very dependent on institutional settings. And I think we've all learned a lesson about the potential risks of that. And certainly we're seeing that most prominently in nursing homes. So, at a high level, I do think we have to ask ourselves, how do we make the system of community supports more resilient? Because there are risks associated with having so many people in the same kind of congregate setting. But at the moment, that isn't really what I wake up in the middle of the night worried about. I worry about, do they have the PPE in nursing homes? Can we separate folks appropriately? Can we test everybody? Can we do mobile testing? Are our nursing home strike teams doing what they need to do? How do we pay adequately so we can staff these nursing homes? We're still in the thick of it, and we will be for a bit.
Next question is for Dr. Alexander Scott from Tim White of WPRI Channel 12. Is the state tracking those who were diagnosed with COVID-19 and got better for their value as an immune in the workforce or possible blood use?
We definitely have access to the patients who are COVID-19 positive, and we are absolutely exploring what can we learn from those who have had COVID-19 in their ability to help others. An easy approach to that is looking at our healthcare workers and those who have had COVID-19, have recovered effectively, are now safe to return to work, and how we can apply them to being able to care for patients who are COVID-19 positive as well. So we're definitely assessing what we can learn, as people are throughout the country, on how we can access and learn from folks who have been COVID-19 positive.
Next question is for the governor from Tony Mendez at Poder 102 FM. Governor, do you know if people who work and use ITIN numbers to file their income tax will be able to qualify for unemployment insurance or TDI in Rhode Island?
I am not sure, Tony. I will, when we do the additional questions after the live presser, I'll get you an answer. Give me a few minutes.
Next question is from Nancy Thomas of RI News Today. Society pushes older people, those over 60, to work longer and longer. Teacher pension and Social Security changes have meant working to 70 and beyond. What support will you offer for those teachers, politicians, office holders, state employees, contractors, and others who can't work from home?
So I'm not sure I understand the question. Many of them will have to go to work, but just under a different set of conditions. So, as I was saying earlier, I would urge all employers, and we'll do this at the state too, to think about what are the changes we're going to make at our workplace in order to keep folks safe who come to work, who are in their 60s. Maybe that means additional sick leave. Maybe that means additional social distancing. Maybe that means additional testing. So it's not that they won't be able to work. They will be strongly encouraged to work from home if at all possible, when at all possible, because that will still be safest. And a lot of people can work from home, or maybe work from home mostly. You're also going to be able to work at your workplace, but it's going to be on all of us to make sure there are new systems in place so that you can be safe.
Our last question today is from Christian Winthrop of the Newport Buzz. We see that the overall number of positive cases among Aquidneck Islanders are quite low compared to the rest of the state. Do you have a breakdown of how many Islanders have been tested, and are there plans to open a COVID testing site on Aquidneck Island?
It's an excellent question. We would have to do additional analyses to understand how many of our tested people from Rhode Island are from Aquidneck Island. We do want to make sure that we are making testing accessible for Rhode Islanders in every element of our state. We welcome hearing input as well. If there are people who are not able to access the testing that's available at Newport Hospital, for example, and to engage with us so that we can make sure that testing is available, particularly with the additional types of rollouts to testing we are working on with mobile testing and other options. So we want to be able to respond to those on Aquidneck Island, in Woonsocket, all areas of our state that need testing.
Thank you very much.
Thank you.